Hello everyone, I'm Urologist Erdem Akkaya. Today I'm going to talk about what anabolic steroids are and what they can do. As we all know, anabolic steroids have become widely used. They were not used so much before. But since they are widely used now, people need to know what they are and what they are harmful to. Anabolic steroids consist of testosterone and testosterone derivatives. As you can see here, testosterone was discovered in the 1930s. Then, in the 1950s to 60s, steroids started to be discovered by athletes. The story of steroids is quite old. And so they started to be used, but they were originally synthesized to be used for medical purposes. But unfortunately, today they are actively used by professional athletes and amateur athletes. As I said, anabolic steroids consist of testosterone and testosterone derivatives. Here you can see that once in the body, testosterone aromatizes into dihydrotestosterone and estrogen. Let's take a look at which anabolic steroids are commonly used. Anabolic steroids commonly used in the sports community include growth hormone, insulin, selective androgen receptor modulators, growth hormone secretagogues and testosterone derivatives. This part actually makes up anabolic steroids. Chemically speaking, there are three types of anabolic steroids: dihydrotestosterone derivatives, testosterone derivatives and nandrolone derivatives. Among the nandrolone derivatives, decabalin is missing here, so it should be included. In general, anabolic steroids are created by modifications of these four carbon rings. There are thousands of anabolic steroid derivatives. They have their own classification of androgenic and anabolic index. Testosterone has androgenic effects. For example, it can cause acne, it can make the skin oily, it can enlarge the prostate. There are also anabolic effects, such as increasing muscle and accelerating fat burning. They try to design anabolic steroids in such a way that the androgenic effect is low and the anabolic effect is strong. They have classified anabolic steroids accordingly. How do anabolic steroids work? It binds to androgen receptors in the muscle and causes muscle formation. It also has a negative effect on cortisol receptors and works in the body by positively affecting IGF-1 receptors. Almost all of them lower sex hormone binding globulin. Apart from that, there are other forms of anabolic steroid abuse. Anabolic steroids have been used in the sports community for nearly 70 years. And more experiences are being passed on from person to person. It becomes a ball of knowledge. There are various types of cycles among users, and we see them here. These are very high doses. What is the problem with anabolic steroids? According to studies in the US, there are 4 to 5 million anabolic steroid addicts. They are called anabolic steroid addicts because they never stop taking anabolic steroids. So millions of people use it for 12 months. In the Netherlands, there are specific anabolic steroid withdrawal clinics for anabolic steroid users. Abroad, this is now seen as a public health problem. And it is an important problem. Because its use is becoming more widespread and the age of use is decreasing. It cannot be defined as an addiction because the use of anabolic steroids does not bring pleasure or enjoyment. It improves the appearance of the body and the person does not suffer from a withdrawal syndrome when they stop using it. After a person quits, when FSH, LH and testosterone levels drop, he may experience some withdrawal. But it doesn't happen to everyone. Addiction is still a controversial topic. The reason why I show these cycles is because they contain very high doses. Indeed, the doses of the drugs used in these cycles are very high, and not only these drugs are used. Growth hormones, fat burners, and diuretics are also used along with those, and also many drugs are used in PCT. When you look at even the simplest cycle, it contains 500 mg of testosterone per week. The higher tier cycles also contain 1000 to 1500 mg of testosterone per week. What are the most common side effects of anabolic steroids? The most common side effects are testicular atrophy, acne, edema in the body, drowsiness, pain at the injection site, sexual dysfunctions, and gynecomastia. In fact, it acts on almost many systems of the body. Apart from that, it disrupts the cholesterol profile. Especially oral anabolic steroids severely impair the cholesterol profile. It lowers good cholesterol, HDL, and raises bad cholesterol, LDL, which increases the risk of atherosclerosis. Those who use testosterone are relatively lucky because it aromatizes into estrogen, so the degradation is a little less. With oral anabolic steroids, this is a much more severe deterioration. There are many publications on pathologic heart enlargement due to anabolic steroid use. There are many studies on left heart enlargement in continuous users of anabolic steroids, independent of heart enlargement in normal athletes. There are many case reports of blood clots. Publications showing that it directly causes blood clotting are limited. Many drugs are used simultaneously and there are many case reports. But many athletes also take medications such as aspirin when using these substances. In addition, elevated hemoglobin levels can increase blood clotting, which should be taken into consideration. It can increase blood levels, especially hematocrit levels around 60%, which is life-threatening. When it rises above 50%, it is recommended to donate blood. There are many case reports on the renal system. There are case reports of a mass in the kidney after use, but the exact relationship has not been established. The relationship with kidney failure is as follows. The person is taking a lot of medication, eating more than necessary, that is, using the body under very extreme conditions. And maybe his blood pressure is rising and he doesn't even realize it. Maybe kidney damage develops due to blood pressure, but of course we don't know that. The drugs used disrupt kidney functioning mechanisms. A person may have a protein leak and this can be overlooked. Kidney failure is not easily symptomatic until it is very advanced. For example, if your creatine level is 1.5, 1.6, you will not feel any symptoms easily. When this gets to an advanced stage, there are problems. Especially in athletes with a high muscle load, creatine levels can be 1.5 or 1.6. In fact, this body looks like this because it has a lot of muscle mass. It is important whether the person has protein leakage in the urine. What is the total amount of protein in urine? Does the person have hypertension? It is useful to perform further kidney tests for kidney function. It could also be that the creatine is too high because of the person's level of muscle load. Since this is a rare condition, doctors can also be surprised. Regarding the liver system, anabolic steroids can cause jaundice. It can cause an adenoma in the liver. This is usually done by oral anabolic steroids that alkalize to 17 carbons. Frankly, I haven't come across many, but there are many case reports in the literature on this subject. There is a lot of literature on the liver due to the use of anabolic steroids, especially in the biliary tract, which can cause jaundice due to disintegration and obstruction and can raise liver function tests. Especially after oral anabolic steroid use, ALT-AST and GGT tests may be elevated. They rapidly decrease when quit. If you want to read it in detail, you can find an article on my website. There is also the issue of acne, as they can cause acne during and after the cycle. It may stimulate some things in the system there. Apart from that, if you have a predisposition to male pattern hair loss may accelerate due to increased dihydrotestosterone. If anabolic steroids are used before bone development is complete, they can inhibit bone growth. Since estrogen is the main hormone that stops bone growth, steroids, especially those that aromatize estrogen, can stop bone growth. Anabolic steroids that do not aromatize to estrogen, on the contrary, are likely to increase bone growth. Oxandrolone, one of the anabolic steroids, was used in girls with short stature. It has also been shown to contribute to growth and development. But these are done under control. In those with growth and developmental delay, growth hormone and aromatase inhibitors are used and estrogen is kept low. But if you take a drug that aromatizes estrogen, it can cause short stature. Also, tendon injuries can occur because the muscles develop fast. Salt and water retention in the body, edema may occur. Water and salt retention is not only due to estrogen aromatization. Oxandrolone and stanozolol do not aromatize to estrogen, but they can also cause water retention. These also improve when you stop the medication. When it is used in men for voice change, it is asked whether the voice becomes thicker and more masculine. When used in adulthood, it does not contribute much, but if used in adolescence, voice change can be detected. They cause gynecomastia. Estrogen, prolactin and progesterone hormones have an effect on gynecomastia. The genetic makeup of the person is also very important. How it responds depends a little bit on that. While some individuals with very high estrogen levels do not have such a problem, gynecomastia can develop in individuals with very low levels of estrogen. There can be many side effects in women, such as voice change, and clitoral enlargement. Body hair growth, menstrual irregularities, breast shrinkage. Psychologically, it can cause many problems. For example, one can lose the ability to empathize. They may not empathize as much as they used to. Apart from that, there are also case reports that it increases crime, violence and aggression. But there are no studies that clearly show that anabolic steroids cause this. In user anecdotes, users report becoming more irritable and aggressive. In my opinion, addiction is like this. If a person has been using it for 5 to 10 years, we can talk about that person being addicted. Because it is very difficult to get someone who has been on these drugs for so long to stop taking them. Because it provides both physical and psychological structures. It can contribute to one's social life and make them more popular and successful. But this addiction is not like alcohol addiction. In alcohol addiction, a person's social life and economy are disrupted. But in 10-year users of anabolic androgenic steroids, the person's work and social life are going well, but he has become addicted to it. Because he is also afraid that he might lose everything if he quits. He has many people working for him, he can give orders to them, and he becomes more popular. He has a busy work schedule and also has a sexual or emotional relationship with his partner. And he needs power and energy to keep them in order. And he may think that when he stops anabolic steroids, he may experience losses related to them. And it is difficult to get these people to quit, and it is also difficult to get the testicles working again after quitting. And you need to do testosterone replacement therapy after stopping anabolic steroids. After stopping anabolic steroids, testosterone replacement therapy is necessary. Because after using anabolic steroids for a long time, it takes a very long time for the testicles to produce normal levels of testosterone, not those high levels. This can take a very long time, especially if the person has reached a certain age. In the meantime, testosterone replacement therapy can be performed. There are not many publications on depression and suicide, but if you want to read them in detail, you can read them on the website. In terms of infertility, we can see it here. When we give testosterone externally, testosterone aromatizes into estrogen. Both testosterone and estrogen put pressure on the hypothalamus and pituitary gland. This lowers the FSH and LH hormones. When these hormones drop, the testicles do not produce sperm and testosterone. With this decrease in FSH, not only testosterone but also sperm production stops. It is normal for steroid users to have no sperm in their semen. But this usually returns to normal within 3 to 9 months after stopping anabolic steroids. One of the most sensitive issues for me is libido and sexual dysfunction. There are patients who come with erectile dysfunction while using the cycle. But if a person does not do PCT after stopping steroids and continues to live with low testosterone for a long time, or if he takes the wrong medicines and doesn't monitor his levels, many, if not all, people may have erectile dysfunction or loss of sex drive. Men are already obsessed with erectile dysfunction once they have experienced it. Men are very sensitive about this. Sexual power is very important for a man. Once they experience it, they always think about it. They always think about this possibility of failure before their next sexual intercourse, and it can take a lot of time and effort to overcome it. For this reason, you should always check yourself after stopping steroids and do not continue with low testosterone levels. Of course, using anabolic steroids increases sexual potency for as long as they are used. Apart from that, it can increase the volume of the prostate in moderate amounts. It may increase the PSA level moderately, but there are not many prostate complaints among users. Of course, since most of the users are well below the age of 50 or 60, they do not develop prostate-related complaints. Testicular shrinkage is very common among users, it can be seen around 60%. After some time after stopping anabolic steroids, the testicles return to normal levels. Or testicles can return to normal size after PCT. It is possible to say that gynecomastia is permanent after it occurs. Erectile dysfunction can be permanent in some patients, especially those on decabolin and trenbolone. For example, this 12-year study was done among powerlifters. The study indicated that the mortality rate would be 4.6 times higher than normal people. This is an important study. According to studies on infertility, not many anabolic steroid users have experienced permanent infertility. But there are case presentations. There is a problem with these case presentations. The sperm count of the person before using anabolic steroids was not analyzed. Therefore, it is not possible to know whether a person had a sperm problem before using steroids. Maybe he had a sperm problem before and this problem persisted. We see many patients like this. It is not possible to understand that a person has a sperm problem by physical examination. A sperm test is required. I have stories of anabolic steroid use on my website. If you want to read them, you can read them. I will add a link to this article in the description. Thank you for listening. Best regards.